Bipap and CPAP policy and procedure. The most common indicators for Bipap or CPAP are obstructive sleep apnea, COPD, and chronic respiratory failure. Verify the physician's order. The order must include settings, supplemental oxygen, mask type and size, and hours of use. When a patient has an order for a Bipap or CPAP machine, the center will call the RHS line. RHS will not deliver or set up a Bipap or CPAP machine without a physician order with specific settings. It is important to note that the vendors who deliver the machines are not clinicians and the machines do not arrive preset. The settings need to be verified and set according to physician orders. The use of a patient's personal Bipap or CPAP machine will only be permitted if the patient is admitted directly from the hospital and was independently using his or her personal equipment during their hospital stay. The patient should be able to demonstrate independent use of their device. Personal equipment brought directly from home is not permitted. However, patients are permitted to use their own mask and tubing. If a patient is bringing their own machine from the hospital, an order should be obtained to indicate that the patient is using their own machine and to document the patient's home settings. The center is responsible for calling the RHS line to notify the representative that the patient is bringing in their own machine and to order a backup unit for the center in the event that the patient's machine malfunctions. RHS personnel are not permitted to touch a patient-owned machine. Providing RHS with the patient's settings will allow them to accurately order the necessary backup equipment. Patient-owned machines must be checked by maintenance to ensure electrical safety. Bipap is not to be used as a life support ventilator, nor should it be connected to a tracheostomy tube or any other artificial airway. Bipap will not exceed 12 hours total in a 24-hour period. The center must have a device-specific backup available for patient-owned units. Equipment needed: mask and headgear. The patient may use their own mask and tubing from the hospital or from home. Specialty masks can be ordered through RHS. Tubing. Pressure line adapter for oxygen bleed-in. Humidification, if ordered. For non-disposable humidification chambers, change sterile water in the humidifier chamber every 24 to 48 hours. Clean the humidifier chamber with mild soap and water weekly. Before moving the machine, remove the humidifier chamber, as water can spill inside the machine and cause malfunction. Document on the treatment sheet to check the humidification chamber. Oxygen source, if ordered. A no smoking oxygen in use sign if oxygen is ordered. Introduce yourself. Identify patient. Explain the procedure and provide privacy. Review safety rules with the patient and verify equipment is connected and settings are correct. The initial setup. Apply ordered settings to the unit per the manufacturer's instructions. The clinical manual will be delivered with the machine. If the manual is not present, contact the RHS line. Connect the end of the large bore tubing to the outflow of the unit. Connect the other end to the external exhalation valve of the mask. If the mask does not have an external exhalation valve, one needs to be added to the mask. If oxygen is ordered, when supplemental oxygen is used, turn on the Bipap or CPAP machine first, before attaching the oxygen tubing. When turning the system off, first remove the oxygen tubing from the oxygen source, and switch to previous oxygen delivery device if applicable, then turn off the Bipap or CPAP machine. Place the pressure line adapter between the unit outflow and the large bore tubing. Connect the end of the oxygen tubing to the pressure line adapter and the other end to the oxygen source. Set the oxygen flow to prescribed setting. If a humidifier is ordered, connect the end of the 18-inch large bore tubing to the outflow port of the unit and the other end to the humidifier. Turn on the unit. Obtain pulse oximetry prior to beginning therapy. Place the mask on the patient. Once a comfortable fit has been achieved, secure the headgear. If a full face mask is used, advise the patient not to eat or drink 2 to 3 hours before use. Monitor for the possibility of aspirating gastric contents. Advise the patient to immediately report any unusual chest discomfort, shortness of breath, or severe headache when using Bipap or CPAP. In the event of a power failure or device failure, immediately disconnect the device from the patient. Ongoing therapy. Fill the humidifier with sterile water if humidification is ordered. Turn on the unit and verify the settings. Apply the mask to the patient. Adjust the headgear to comfortably fit the patient and ensure minimal leakage. A small leak is acceptable. Position the exhalation port away from the patient. Monitor the patient for skin irritation or breakdown under the mask, tolerance to the mask and Bipap and CPAP settings, adverse reactions including severe headache, chest pressure, and shortness of breath during therapy. Monitor pulse oximetry once a shift after therapy. Clean the unit weekly. Refer to the nursing procedure, respiratory equipment, supply cleaning and disinfection. Unplug the unit. Do not immerse the unit in liquid or allow liquid to enter the unit. Using a cloth, slightly dampen with water and mild detergent. Wipe the outside of the case. Let the unit dry before connecting to a power source. Clean the mask as needed per the manufacturer's guidelines. Clean the headgear, chin strap, and/or soft cap as needed per the manufacturer's guidelines. If using a humidifier system, clean it weekly. Detach the 18-inch tubing from the outlet port of the unit. Remove the humidifier, chamber, or device from tray or heater. Remove the large bore tubing from the interface. Wash all items in a solution of warm water and mild detergent. Rinse well and let air dry. Change the intake filter per the manufacturer's guidelines. Documentation. Assessment of the patient before the procedure. Settings. In general, Bipap requires 2 pressures and CPAP requires only 1 pressure. Specialized Bipap and CPAP units have advanced settings. Please contact RHS for additional support. Mask size and type. Date and time of Bipap and CPAP initiation, and the mode used. Length of time Bipap or CPAP is used. Supplemental oxygen, if applicable. Humidification, if applicable. Tolerance of Bipap, CPAP mask. Patient evaluation. Pulse oximetry prior to and post-therapy. Notification of physician of any adverse reaction.